there. So today I'm going to be talking on acne. So we're going to be talking skin issues, acne, because acne affects all age groups from the newborn even to late adulthood. So it really is common. The peak incidence is usually when the people reaches adolescence, which is a real pain. So with acne, the risk of having an endocrine disorder or hormone sort of imbalance is quite high. For example, females that have polycystic ovarian syndrome, people with elevated cortisol levels, with high testosterone levels, so that can cause it. The main culprit when it comes to acne is usually the sebaceous gland. So this is usually attached to the hair follicle, and it produces something called sebum, and that will lubricate your skin. So that's the main culprit in acne. These sebaceous glands are particularly well developed and dense on areas like the scalp and the face and the trunk, and that's why you mainly get acne in these areas. So how does acne form? So basically you get blockage of the hair follicle. You also get increased sebum production due to maybe elevated androgen stimulation, for example, in polycystic ovarian syndrome. You then get collection of bacteria, and that bacteria is usually called Cutibacterium acne, a big word. And then you get an inflammatory response, and then you would have the formation of acne. So when I talk about androgens, because I'm going to talk about androgens quite often, this is basically the male sex hormone or sex hormone. So it's basically the main hormone androgen in males is testosterone, just that you know what I'm talking about. You get different types of acne, even whiteheads, blackheads, papules, pustules, and those nodules or cysts, those big red angry ones. Those are all fall under the term acne. Then these cystic ones can result in that ice pick scarring, you know, the permanent scarring that we hate. You also can get darkening of the skin in those areas after that as well. So this can all happen. There's some people that says diet can play a big role. Some people say it's nonsense. There's been studies on something weird, like specifically skimmed milk. If you consume lots of skimmed milk and you're prone to acne, it can worsen that, probably because skimmed milk contains hormones like androgens, estrogen, progesterone, and even glucocorticoids. That's what they say. Also, a diet with, you know, when people say, yo, stop eating sweets, that's not really true, but a high glycemic index GI diet can cause your insulin to increase. And if your insulin increases, that can actually stimulate androgens, once again, glucocorticoids and growth factors, which causes an increase in sebum production, which can then worsen acne. So that's interesting. If I want to name a few types of acne, for example, the one that I was talking about, the angry one, we call acne conglobata, also a big name. Those are severe nodules and cysts. Then you get acne from obsessive scratching or picking from the skin. You can get that. There's usually a psychiatric component to that, a bit of obsessiveness. Drug-induced acne, for example, these big strong men or even females, the anabolic steroids that they use, that can cause increased sebum production and also acne. Then you get neonatal acne. That's the newborn baby in the first month of life. That can be quite, that's common. And also infantile acne, that's from sort of 6 to 12 months, when there's a physiological increase in androgens and hormones. And there was recently a new phenomenon called something stupid, I think anyway, but it's called maskne. And that's acne that gets exacerbated by wearing masks for a long time, like during COVID that we've done. Or if you've got acne and you wear the mask, it can actually make it worse if you've already got acne. Hopefully this is something of the past. I can just hope. Then when you get to treatment of acne, it all depends on the severity of the acne, whether you're male or female, whether you've got comorbid, comorbidities like endocrine or hormonal issues that you must obviously treat as well. So you'll get topical treatment, which is local on the face, obviously, and then you get systemic treatment, tablets or whatever. So when I talk about topical treatment, I'm not going to punt any specific brand. I'm just going to name them because you might know what I'm talking about. So the first one is benzoyl peroxide. For example, the Benzac AC gel, you might know that one. Then you get topical antibiotics like clindoxal gel. You get the retinoids like Retin A. I think most women know about the Retin A. And you also get different types of acids like Skinnerin gel, Differin gel, Epiduo gel. You might know all of that. And often you'll use a combination of these. You don't just have to use one. You can, for example, use benzoyl peroxide with the antibiotic or with one of the acids, so you can do that. You'll obviously start using topicals with mild to moderate acne. You can, as I said, you can use even combinations. But when you get to the severe cystic acne, that really causes big problems, you would often use an antibiotic, a systemic antibiotic combined with your topical treatment. Sometimes you can use hormonal treatment. When it comes to females, you can use a contraceptive pill. That can work well if it's indicated. But if you get acne that really is the bad ones, the nodular or cystic ones, then you're going to maybe look at the systemic retinoids. Those are the ones, we all know the word Roaccutane or Acnitane or Oratane, there's lots of them. It's very important. Obviously, those medications, they have side effects. So you have to be, it can make your skin very dry. It can make your skin inflamed. You have to be really careful with sunshine. So if you're a young adolescent and you're out in the sun all the time, you really must be very careful because it can cause big havoc with skin burn, sunburn and all of that. And then if you're a female, it's very important that you use some kind of contraception, because should you fall pregnant, it's a big problem. These drugs can cause serious birth defects. It can cause premature births. It can cause miscarriages. So when it comes to females and the retinoids, just be very careful that you don't fall pregnant. In fact, I think it's almost law that we have to make sure that our female patients are on some kind of contraceptive when using those. So that is a summary of acne. I'll chat to you next week on vitiligo, also another interesting skin condition. Till next time, bye.